Okay, so I believe this is on. Hello, everyone. My name is Elizabeth Baki, and I am a P4 here at UF in the pharmacy program. Basically, that means I am a senior in college, but I'm only in my second professional year of pharmacy, so I still have 2 years to go. Today, I'm going to be talking about medication adherence in women, and let me go ahead and get my PowerPoint pulled up so I can present to you guys. Okay. Okay, so I believe you guys should see this. Hopefully, my face is in the corner. If not, I'm still here. Obviously, I will speak about the whole presentation, but let's get started. So, like I mentioned, I'm going to be talking about medication adherence in women, and this is just a brief table of contents on what I'm going to be covering today. Okay, so why is this topic important? Adherence is the key link between treatment and outcomes, as well as it reduces the disease complications, as well as it improves the quality of life in a patient. So, number one, what is medication adherence? So, as the definition I have here, medication adherence is the degree to which a patient's adherence to medication aligns with the health advice they have received. So, for example, that would be you have an antibiotics taken 4 times a day, spaced out every 8 hours, and the patient does that exactly as the prescription says. So, medication adherence is one of the most important factors that can determine therapeutic outcomes for patients. And unfortunately, the average older adults that are fully adherent is only 50%. So, some consequences that go along with not being medically adherent are unnecessary health costs. So, if you end up in the hospital, increased social and economic costs, recovery and delays, and increased mortality. And the top 3 factors that affect medication adherence are health literacy, education level, and social support. And I'm going to be going over those in the next couple of slides. So, like I said, what are the factors? And this is point number 2. So I have a graph here. Hopefully you can see my mouse to kind of point that each of these 3 factors directly affects our medication adherence. So, health literacy, as I have my definition, it's the ability to read, understand, and act on health information. And some risk factors for health literacy are the older age population, which is a why we're in gerontology, right? And limited education, lower income, chronic conditions, as well as other, which kind of was a broad category. So, a couple examples would be cognitive decline, physical limitation, and complex medication regimens. So that would be someone that has like over 10 medications they take on a daily basis. So the reason we care about health literacy is because no matter how health literate someone is, everyone should be included and have the same quality of care, which in turn will improve patient experience. So another factor is education level. And a lot of this information I talk about next, either I have directly talked about in my gerontology midterm as well as in my last year's pharmacy classes. So I pulled this directly from one of my professors' PowerPoints to talk about education level and health literacy. So the English literacy of adults in the United States was evaluated in 2003 National Assessment of Adult Literacy, or NAAL. And this graph here, like I said, hopefully you can see my mouse, that over 50% are pretty well, they can understand health literacy, and only 12% are proficient, which is more than likely going to consist of your doctors or healthcare providers, which is why it's so important for doctors, pharmacists, and even some nurses to be able to explain to patients how and why to take their medications. So, social support for women, this was my gerontology midterm. Social support is really important as it provides a link to lower mortality rates because everyone needs to have a social circle. Patients from cohesive families demonstrate a higher adherence to medical treatment, and supportive measures that positively influence the outlook and recovery of individuals diagnosed with a serious illness tend to do much better because they have that support group that is able to help them care for them and like it says, give them the support they need to get through a difficult time. Okay, number 3, the overview of geriatric women's health. So some basic facts here are that women typically live longer than men, but because of this, more women will tend to live alone in their older ages, as well as they will end up on Medicare and be impoverished. So basically, the way I looked at that is you only save up so much for retirement. Well, because they're living longer, they're having to spend that amount of, they have to spread that amount of money. I'm sorry, my words are getting twisted. Over a longer period of time to, basically have a full functioning life, as well as more women will end up in long-term care centers because of their advanced age. So some multiple roles and relationships for women are spouse, parent, sibling, or friend, just to name a few. And most caregivers are women, which can take a toll on the body. So this can be due to stress, physical strains. So if a um, a wife is trying to help her sick husband to the bathroom, that can be just a lot of strain on her body just to try and help him get to the bathroom, then get him situated, and then get him back up and get him back to his bed, as well as lack of self-care. So when I think about that, I think of a parent. So take care of your kids first, and the moms will usually take care of themselves second. Sorry, quick water break. Okay, so causes of death in women. And this study looked at the leading causes in 1997, which is a little bit older, but I would assume most of this holds true. So, unfortunately, cancer is the number one cause of death for women. The top 3 would be breast, lung, and colorectal. Then we have cardiovascular diseases, so hypertension or high blood pressure, coronary artery disease, which is surprisingly the leading cause of death in women overall, but it's not the number one cause of death, if that makes any sense, as well as stroke, and then over 20% is either unknown or other. I also wanted to point out some chronic conditions that women face as they age. So diabetes, osteoporosis, cognitive impairment, and urinary incontinence, as well as depression. So now I'm going to talk about the 3 articles that I have referenced to talk about medication adherence. So my first article was over cognitive factors and medication adherence. This article found no significant difference in medication adherence between men and women, which I found surprising. And some reasons for medication non-adherence is embarrassment, which I never really thought about until I was thinking of I don't want to say like the classic joke of, someone goes to the pharmacy to pick up a prescription for an anti-diarrheal, and always seems that the pharmacist yells that they have their anti-diarrheal medicine ready. And the patient's obviously embarrassed because they don't want people to know. And the second highest reason is problems opening the drug containers. So I do want to clarify is that people that do struggle with strength to twist open the childproof caps, they can go ahead and request the twist off rather than the childproof, so then they don't have to struggle as much. Another reason for non-adherence is difficulty swallowing, uncertainty about proper administration of medications, stopping the medication to see whether it's still needed. A great example of this is hypertension or high cholesterol. So although the patient doesn't feel a physical change, their overall health has changed. But because they're not feeling it themselves, they think they don't need to take it, which is why they stop to see if it's really needed, as well as the belief that the medication is not needed. Also, some other factors that influence adherence are, having multiple medications. So the more the more medications you take, the more likely you are to be less adherent. Development of cognitive impairment, functional limitations, poverty, transportation limitations, as well as patients' beliefs and attitudes towards medications. So this chart here, it's kind of the summarized of the differences between men, women, and kind of the group of older adults that factor for low medication adherence. So for men, it's their marital status, medication adherence efficacy, medication adherence reasons, and for women, beliefs about medications and illness perception. And for older adults, which is kind of both because you can have older men and older women, is forgetfulness, chronic nature of disease and long-term medication use, as well as reduced elderly and provider relationship. And this table is pulled directly from this article. I wanted to highlight in the red boxes were some of the main things that I took away or that I thought were important to note for you guys is although they said that there wasn't a clinical significance between men and women's adherence, you can see in this chart that women were slightly more adherent than men. And obviously that marital status versus living alone, that social group factor showed to be very important. So being married had a higher adherence and living alone had a lower adherence to medication. Sorry. So the next article is gender disparities in medication adherence. So they also did not find a prevalence, they also did not find a significant difference between the sexes for medication adherence. I found it really surprising that in this article, more women were less adherent than men, whereas the other article, more women were adherent to medication. So it's kind of a toss-up. It's kind of 50-50, really. And again, the chart, same thing. Factors that affected men were low sexual functioning. For women, it was dissatisfaction with communication with their health care provider. And for both men and women, it was issues with medication costs as well as practicing fewer lifestyle modifications. I also did want to note that the article mentioned that women were more likely to report depressive symptoms, lower social support, higher stress, and lower levels of sexual functioning, which I believe also played a role in for the lower medication adherence. So I believe this is my third article. They're kind of starting to get jumbled up in my brain. So medication adherence in older women. So this article is going to focus specifically on women, not men. So the article aimed to describe a key perception that influenced older women's adherence and persistence with prescribed medications. So this article specifically not only focused on women, but women's medications with osteoporosis. And they found no overall predictors of adherence. Participants' perceptions and motivations to continue with medication regimens were influenced by 6 core themes. Number 1, understanding adherence and non-adherence. Number 2, motivations and self-care. I believe in this article they said that all participants realized that there needed to be a change in lifestyle in order to live a longer life, and they were all more than willing to start that transition into their modifications. Number 3, appraising and prioritizing risk. Number 4, anticipating and managing side effects. And I was surprised to see that for the side effects, a lot of people complained of them, but there was still a decent amount that stuck to their regimen because they believed that it would help impact their health overall. And number 5 was another big issue, problems in understanding. So some participants didn't understand the difference between falls versus fractures, as well as why the medicine was preventing or managing their osteoporosis and what the difference is, as well as decision making around the medications. So for one of my last couple points here is the similarities between the three articles is that there is no significant difference in medication adherence between men and women. And the big three key takeaways is that the relationship with the healthcare provider is crucial in being medically adherent, which is, I think I said it earlier, patient counseling is really important in the pharmacy field and making sure patients know how to take their medicines because that is the determining factor on whether the patient is going to take it correctly or not, as well as modifications are required to help with medication adherence. So I believe it was in my second article, people that aren't willing to make changes in their lifestyle tend to not be as adherent. And I would believe that's kind of because I don't want to say they're stubborn, but they're like, I've lived this long. Why do I need to change what I'm doing? And number three, decision making is a necessary step in patients with multiple chronic illnesses. So, a great way to think about this is patients that are, diabetics, have hypertension, are heart patients, uh, any sort of patient that has multiple chronic conditions at once. And obviously, there are a lot of meds that these patients have to take. And at a certain point, it can get really expensive. And patients may have to decide, like, what medication is more important for me to take rather than, having five at once. And the doctors will help patients look at what specifically they should be taking to help control their conditions. And last but not least, strategies for improving adherence. So there are quite a bit. So in person or with a pharmacist or some sort of healthcare provider is to assess understanding with open-ended questions. So they teach us, at least in pharmacy, the three prime questions. How did your how why did your doctor tell you you're taking this medication? How did your doctor tell you you're taking this medication? And what side effects did your doctor tell you to expect? That's a big thing that we're taught to counsel patients with. The teach back method. So after we go through those three prime questions, say, I really wanted to make sure we covered everything today. Could we go over the questions again, but you're asking them to repeat what you had said and making sure they have all the major points hit. Visual aids, so that would be really good for inhalers, materials in different languages, interpreters, using layman's terms. So an example I gave earlier was hypertension. So instead of saying hypertension to the patient, you say high blood pressure. And simplifying medication regimens and addressing financial barriers. And what patients can do at home is have medication reminders like apps. So my fiance actually has this for his medicine, and he takes it every night. So it'll ring at a certain time at night for him to take it. And if he doesn't take it, it'll keep ringing until he does. Telehealth, which is where a team of pharmacists can call over the phone and check up on patients. Having wearable devices, pill organizers, and having family members engage in their care as well. All right, so that is my presentation. I'm going to go ahead and upload this to YouTube as well as put the link to this PowerPoint if you guys wanted to go through it again. And if you did have more personal questions, I left my email for you to email me. And these are my references. So I hope you guys enjoyed. I know sometimes the medical stuff can get pretty boring, but at least for any sort of healthcare worker, it is important information. And I hope you guys enjoyed. Thank you so much. Bye.